Today, we're diving deep into one of the most fundamental questions in all of medicine. We're going to decipher the very language of disease itself. Let's get right into it.
Think about it. When you get sick, you go to the doctor, you tell them you feel awful, you have a fever, a cough, but how do they really know what's happening inside you? It's not magic, it's a science. And that science is what we're exploring today.
So, here's our game plan. First, we'll nail down what pathology even is. Then, we'll see how it acts as a bridge in medicine. We'll meet the disease detectives themselves, and then, this is the cool part, we'll break down the four-part framework they use to solve every case. By the time we're done, the whole process of getting a diagnosis is going to make so much more sense.
Okay, first things first. What in the world is pathology? Well, put simply, it's the scientific study of disease. It's all about figuring out what's going wrong in the body, and most importantly, why it's going wrong.
But to get a little more specific, think about any lab test you've ever had done. A blood test, a urine sample, a biopsy. Pathology is the science that takes all that stuff, your tissues, your cells, your body fluids, and puts it under the microscope to find the hard evidence of what's causing the trouble. It's the foundation of almost every diagnosis.
Now, it's really easy to just picture a scientist in a lab coat, totally separate from the hospital, but that's not the whole story. Pathology is actually the critical bridge that connects all that fundamental science with the actual real-world practice of treating patients.
And this tree analogy is pretty much perfect. Imagine medicine is this giant tree. The roots, deep in the ground, are your basic sciences. Anatomy, biology, physiology. The branches way up top are all the clinical specialties, like surgery or pediatrics. So what's pathology? It's the trunk. It's the essential core that pulls all the knowledge up from the roots and delivers it to the branches so they can thrive. Without that trunk, the whole system just falls apart.
So, how did we get here? Well, back in the 18th century, guys like Giovanni Morgagni started connecting the dots. They'd look at a patient's symptoms when they were alive, and then, after they passed, they'd look at their organs and see the physical changes. But the real game changer, the big one, came in 1858 from a man named Rudolf Virchow.
Virchow came up with this idea, summarized in this Latin phrase, omnis cellula a cellula. It means every cell from a cell. And this was a huge deal. He was saying that disease doesn't just randomly happen to an organ. No, it starts at the tiniest level. A sick organ is sick because its cells are sick. That single idea is the bedrock of all modern medicine.
So, who are the people putting all this into practice? We call them pathologists, and honestly, the best way to think of them is as the true detectives of medicine. They're the ones who take all the clues the body leaves behind and piece them together to solve the mystery.
And their detective work is incredibly varied. They're the ones looking at a biopsy to see if it's cancer. They're studying the individual cells from a pap smear to catch abnormalities early on. When someone dies unexpectedly, they perform an autopsy to find out exactly why. And yep, they're also in charge of the clinical labs, making sense of all those blood and urine tests.
And what I think is so cool is the scale they work on. I mean, look at this. On one hand, they might be looking at the big picture, the gross changes to an entire organ, like this diseased liver. But then, they zoom all the way in, down to the microscopic level, to see what's happening with the individual cells. They have to understand the crime scene from every possible angle.
To do that, they don't just guess. They have a system, a playbook really. It's a four-part framework they use to investigate any disease. Think of it as the four essential questions they have to answer every single time.
And here they are. First, etiology, which is the why. Second, pathogenesis, the how. Third, lesions, the what. And fourth, pathophysiology, which is the ultimate effect. This structure is how they take something complex and confusing, like an illness, and turn it into a problem they can actually solve. Let's break those down.
First up is etiology. This is simple. What caused it? What's the origin story? Was it a genetic thing? Did you catch a bug, like a virus or bacteria? Or maybe it was something in the environment, like a toxin. Finding the cause is always step one.
Next up, you've got pathogenesis. This is the how. So once that cause gets into your system, what happens next? What's the step-by-step chain reaction inside your body? Pathogenesis is literally the story of how the disease unfolds, from that first trigger to the final outcome. The physical evidence of that story is what we call the lesion. This is the what, the actual physical damage or change to the body's structures.
And as we saw a second ago, these can be gross or macroscopic, meaning you can see them with your own eyes, like a tumor. Or they can be microscopic, where you need to zoom way in to see that the cells just don't look right.
So that's the scientific framework. But how does all this stuff actually show up in a real person? Well, this leads us to a really important distinction. The difference between you feeling sick and a doctor being able to prove you're sick.
And here's the key difference. Symptoms are subjective. They're what you feel and report. You say, I have a headache or I feel dizzy. A doctor can't measure your pain, right? Signs, on the other hand, are objective evidence a doctor can measure. They can stick a thermometer in your mouth and see, yep, your temperature is 101. They can wrap a cuff around your arm and see that your blood pressure is high. Both are crucial clues for the investigation.
Okay, let's bring it all home. How do we take that framework and those symptoms and signs and put all the puzzle pieces together to actually get a diagnosis?
Well, it all starts with your doctor taking your medical history. They're listening to your story, collecting all those symptoms. Then they do a physical exam, searching for those objective signs. Based on what they find, they'll order some lab work. And that's the moment pathology steps in to provide the definitive proof, analyzing your samples to confirm the diagnosis. And finally, the doctor puts everything together, your story, their findings, and the lab results to give you that final concrete answer.
You know, this whole systematic approach we've just walked through, this whole idea that disease starts in the cell, it completely changed the world. It gave us a logical, scientific way to make sense of what goes wrong in our bodies. It really makes you wonder, doesn't it? What's the next big idea out there that's going to change everything all over again?